Good morning, everyone. Thank you for joining PHCA for today's webinar, Your Duty and Mine, VA Helps You, You Help Vets. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a couple of housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website later today. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those of you who have provided us with your unique NAB registry number. I'll be sending a link to a quick survey. Your feedback is important to us and our speaker, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. Today's webinar is being presented by Mike Holovacs, Veterans Services Representative with the Department of Veterans Affairs, Veterans Benefits Administration. Veterans Affairs benefits can be a complicated process for your qualified clientele. This presentation provides the resources your facility needs to help identify those qualified for benefits, how to start their application process, and how to avoid common delay-inducing pitfalls. Mike will cover 5 reasons that sales personnel should seek out veteran residents and how prioritizing veterans can be both financially intelligent and personally rewarding. I'll now turn the webinar over to Mike.
Good morning and welcome, everyone. As Wendy said, my name is Mike Holovacs, and I'm a veteran service rep at the Philadelphia Pension Management Center. You might see it on the slides here and there as PMC. Always introduce the acronym before you use it. Thank you for everybody for attending, and before anything else, to any vets in the audience, thank you for your service. The Philadelphia PMC has wanted to do outreach for some time now, and we wanted to show the assisted living community essentially who we are and what we do from the perspective of helping vets and spouses and beneficiaries, and by extension helping you. This presentation is geared more toward you as the assisted living community than it is toward a claimant audience. Wendy said I'll be happy to take questions and answer to the best of my ability while in the call. If there's a lot of questions, or if there's anything that that's brought up that needs any kind of further research, through Wendy, I'll get back to you all as soon as possible if there's like a frequently asked questions or anything like that. The agenda today is pretty straightforward. Who we are, what we do, a quick overview of the pension program, and then we'll cover where VA benefits and your community of sales managers intersect. After that, we'll show a quick synopsis of service requirements that'll help to qualify your leads for further VA follow-up. The second half entails the 3 financial determinants of VA pension entitlement, which are income, medical expenses, and net worth. And we're going to close with a Letterman-style top 10 list and then open Q&A. In the documents section of the webinar, there is a PDF of these slides. Feel free to hold on to it, download it. The links toward the end of the slide, toward the end of the deck, are going to be extremely helpful. They will come to play later in the story. This is essentially a basic reference for resources and questions geared toward your community. If you have vets that are pensioners, beneficiaries, or if you have new people coming in that are looking to come to your communities, you don't necessarily want to frustrate them. And we'll get into some other sales type stuff in a little bit. And believe me when I tell you, we enjoy sending out award letters much more than we do debt notices. So hopefully this seminar will answer some questions for everybody. We fulfill President Lincoln's vision to care for him who shall have borne the battle and for his widow and his orphan. That line was in Lincoln's second inaugural that was delivered March 4th, 1865. One little fun fact, Veterans Pension is the oldest federal entitlement program. It originated August 24th of 1780 when the Continental Congress passed the first act offering pensions to widows and orphans of soldiers that fought in the Revolution. On the right of the slide, you see our service area in map format. It's up on the top of the slide in text. And on the left is our building. And if you look really hard and squint, you can see me waving from the roof. Just a little bit about us. There are 3 pension management centers throughout the country. We are statistically the busiest of the 3, but that doesn't mean that the claimants in our service area wait the longest. VA, VBA rolled out a national work queue system recently that matches caseload to capacity. So the other, all 3 pension centers, it's us, Minneapolis, St. Paul, and Milwaukee, all act as relievers for each other. It's basically they have fewer claims than A has fewer claims than B. Let's send that work there and get them done faster. Here in Philly, we are also home to the only dedicated call center in the country for pension calls. All of the VA press that's out there, the number goes to the national call centers, 800-827-1000. The pension specific number is 877-294-6380. And if Wendy can put that in the chat, if somebody wants to write that down or what have you. Just a little bit of a snapshot. Fiscal year 17, we did a little more than 229,000 claims as far as individual pieces of work. For Philadelphia in fiscal year 17, we had just under 259,000 pension recipients, 67,000 of which were spouses, and that's current as of this past February. Or no, I'm sorry, 67,000 were living vets, 62,000 were surviving spouses, and another about 130,000 were receiving death compensation from service-connected death. And the head counts on the slide as far as people were current as of yesterday, and it's early in the day, so hopefully they haven't changed. Okay. For whatever reason, when people want to interact with VA and mail us things, they like to just send whatever they want to send to the closest local regional office, wherever that is. That address displayed is our dedicated address for pension materials. We receive about 1,100 pieces of mail a day, and it's much faster for all involved to use this address. We are physically located in Philadelphia, but we also don't use paper mail. The folks who scan and upload the mail for us actually sit in Wisconsin, and sending paperwork to your local VA office, it honestly just creates a preventable delay because all they do is forward it to that address. Claims are typically established about 5 to 7 days after receipt of documents. And generally speaking, faxing is faster than mailing. A lot of people do both, but I just want to put it out there that faxing typically gets done faster. Okay, pension overview. 2 things, 2 of the 3 factors right here, eligibility and entitlement. VA pension is a needs-based benefit, and we're showing the contrast between eligibility and entitlement here. Just because a veteran or a spouse or a child is eligible does not necessarily mean that the claimant is entitled. The only way to absolutely be sure of eligibility and entitlement is to have the VA adjudicate a claim for them. The easiest thing to say upon asking if a vet or spouse might be eligible is just to tell them to apply. I'm not coming out here to the nursing home or assisted living community expecting people in the business offices to all of a sudden become VA experts. You know, they certainly have enough on their plate. So the last thing I want to do is say, oh, here's everything you need to know. Bye. I'm not going to do that. That is for veterans pension, and there's survivor's pension for a surviving spouse. Again, it's one of those for whatever reason things. There's a thought out there that the relationship with VA is over when the veteran passes away. That is very much not true. We have spousal and some children's benefits as well. So a surviving spouse must have been married to the vet at the time of death and married for at least 1 year, have a child that was born of the marriage to them, or to them prior to the marriage. They need to have lived continuously with the veteran, and as far as service-connected death benefits, remaining unremarried is key, at least up until age 57. But in the another misconception that's easy to clear up, in the case of a vet's death, the surviving spouse doesn't automatically continue to get benefits. It's not private sector retirement in that they build in a survivor plan. So when the vet passes away, the spouse does have to apply in their own right. Okay, and having a child with the vet is not a requirement, but that's what my notes said. Okay, spouse has to apply in their own right. So, okay, here's where it gets interesting for the assisted living community, VA and sales managers. 5 major dividends possibly for your facility and your client. Number one, you are helping that family pay for their elderly relatives' care, whether it's a veteran or a spouse, or in some small cases could be a helpless child. I look at that as it's possibly helping you to reduce your facility's accounts receivable, since you're helping the family find funding. Why would you not help them find money to pay for their care? A lot of people sell houses. Well, okay, they can, but there's an option before that, and VA pension is it. Getting a veteran on pension benefits will also help speed a decision for burial benefits. If you as a facility are admitting a veteran, VA keeps everything that's submitted at all times, and we refer back to prior paperwork as needed. If somebody gets denied for a pension, it's not permanent. Reapplications are allowed. You would just have to meet those requirements to get approved. When a living vet gets approved for pension, they also, again, generally speaking, there are some caveats, but generally become eligible for burial benefits. Number 3, there is an increase in customer service, and following that, an increase in revenue, you would hope. Your VA knowledge might help close the sale. It might be able to help you upsell, or you might get referral business out of it. Number 4, if you are a Medicaid facility, the switch to the $90 Medicaid rate, very, very easy process. It's something that is 2 pieces of paper, generally. Last but not least, in cases of clients with cognitive issues, VA may rate them incompetent to handle their funds and appoint a custodian or a fiduciary. We take that very seriously, and we look at that as helping to prevent elder abuse. So you in turn would be helping us to continue preventing elder abuse. Another thing that's a misconception, too many family members confuse what it is that we do and a veteran's military retirement benefits for 20 plus years of service. If your salespeople ask a potential new client if they're a veteran, also ask if they're retired military, because one has nothing to do with the other. The pension program is based on calculating income versus medical expenses, and drawing retired pay doesn't create a hard bar to eligibility. We are looking at the gross total of the income, not necessarily always where it comes from. So we do have both military and civil service retirees and their spouses as pension beneficiaries. When I worked in the call center, people would think that they were talking to the people who administered the retirement checks, and we would point them in the right direction. But the two things are mutually exclusive. They are totally different. Wartime service requirements, those dates, as long as you have 1 day of wartime service in those windows, we'll get to the asterisk for Vietnam in just a second. You are presumed to meet the wartime service requirements. We'll get into character of discharge and some other stuff in just a minute. Veterans with Vietnam era service are entitled to use that earlier date of February of '61 if they were on the ground in the Republic of Vietnam during that time frame. The later date is reserved for all other service members. Another dip into the fun facts department. As of last April, we are still paying one pensioner whose father qualified for pension based on Civil War service, 8 spouses and children from the Mexican Border War, 84 spouses and children of Spanish-American War vets, and about 2,500 World War I spouses and children. There are no living World War I vets left. Last one died a couple of years ago. Okay, service requirements. The top and bottom sections are where I would put my attention if I was in your shoes listening to this. The middle section about disabilities is the kind of thing where you'll hear a vet coming into your facility and maybe their son or daughter is helping them with paperwork or shopping for facilities or what have you. And you'll hear something like, well, Dad enlisted rather than get drafted, and he wasn't in for very long. I know that. He graduated basic training and fell off a ladder 2 weeks later. I know for sure he never went to Vietnam. A situation like that is not a clear-cut denial or grant. All we ask is that you encourage the application anyway. Since we're the only ones that can say no, we look at it as there's nothing to lose. At least the family finds out that they can't qualify for a benefit. Types of discharge. Family members will often ask us how they can verify military service of their parent. Any of the vets in the audience know that the easiest way to do this is to provide a DD Form 214. It's the golden ticket when you separate from military service, or its equivalent when you put in your claim package. The VA is obligated by law to search for records, but it will probably take us longer than you. It'll then take us longer to approve or deny that claim. One thing, please don't send us originals. They generally don't get returned. If a vet or family member doesn't have records, just jump on Google, type in SF 180, Standard Form 180, to the in the search bar, and fill that out. The National Archives and Records Administration will get back to you with what they have. Income is where it gets a little bit crazy. We're going to show an example in just a second, but most gross income is countable. We say most because there are income types that are not countable. The spreadsheet of income types that's embedded on the slide has a list of countable versus not countable. That list is not all inclusive. And the one item that I know for sure that list doesn't address is long-term care insurance. Long-term care insurance is considered countable income if the insurer pays the claimant. It is not countable if the insurer pays the facility. We also do income verification with Social Security Administration data. We use this to verify the income reported on original claims, first time coming in the door. Pension rates are considered provisional. They can be raised and lowered retroactively based on income and medical expense changes. Payable rates are anywhere from a couple of dollars a month all the way up to a vet with a spouse who is in need of constant aid and attendance. Could be as high as $2,169 a month, $2,169. It just depends on things like countable income, their dependency if the spouse is still alive, and their overall medical status. Okay, so Tarzan and Jane are both veterans. Who knew? and that's their gross Social Security checks. I don't mean to scare anyone off with math, but I'm a pension maintenance rep and I work claims that have already been established and running. So this kind of thing is my daily life. Um, Changes in medical expenses can cause overpayment debts or retroactive payments. And the protocol for reporting these changes in expenses we're going to cover next, but I just wanted to throw out a extremely easy, extremely generic sample. So the income for VA purposes is income minus medical expenses, and there's a 5% deductible applied. We'll get to that. And the MAPER, the maximum annual pension rate, that is a rate set by Congress that your adjusted income must be under in order to qualify for pension benefits. Um, I would rather take questions on this toward the end. I don't really want to pause for questions. We can go back to the slide if anybody has anything, but that is the income calculation side of the house. Now, how do you reduce your income? You reduce your income with medical expenses. Expressed real quickly, countable income for VA purposes, I just said it's household income minus the allowable medical expenses with a 5% deductible. VA Form 21P-8416, a screenshot of which is on the right. Real quick before I forget, if you need a VA form, we have links at the end of this presentation, but if you search VA form and the number in Google, in an overwhelming amount of cases, the first result that comes back is the copy of the form direct from us. The address will be vba.va.gov. Let's see. We bring up medical expenses as a means, or to discuss with the assisted living community, as a means to discuss potential for errors. Any increase in expenses must be reported on what is a secretary prescribed form, which is the actual form itself. Decreases you can just write on a piece of paper and put it in the mail, but increases need to be on forms. The theory is that these forms get submitted once a year unless the claimant or the family member, custodian, what have you, gets a letter from VA asking for something differently, or if they have a change in status. For example, spouse passes away before the veteran and we need to change their dependency status. If you are a facility that adjusts billing based on level of care, please keep it in the back of your mind. Counsel your claimant, your lead, your families to use the lowest number that you would charge, because turning in medical expense reports every month, every quarter, what have you, that has the potential, especially if there's a change in billing, to needlessly confuse your client or their family and possibly cause several overlapping overpayments. It's just not a good idea. What I used to tell folks when I was in the call center, keep your expenses running throughout the year and either keep them on the form, keep a ledger, do what have you. Our rule is that the medical expense report has to be turned in by the end of the following calendar year. So 2019's expenses have to be turned in by December 31st of 2020. I used to tell folks in the call center, when you have your full year of expenses laid out, put it on the form, sign it, send it in January, and get it done with for all of last year. Everything is or can be retroactive to the last year. There's a misconception out there that VA provides direct reimbursement because the form uses the term expense report. People think expense report in the corporate world. That is not the case. The VA pension payment is the difference between their income for VA purposes, when you go back to the math slide, and the maximum annual pension rate. In the interest of absolute transparency, at the bottom of this slide for a list of common expenses allowed, that's a link to our adjudication manual. And that will give you the exact list of what it is that we can and can't consider. Other things can be considered with doctor's notes. It's case by case basis, but that is the list. Definitions for us: assisted living, independent living, and custodial care. The business office folks probably know this stuff cold already because you have the form that has activities of daily living. Um, Activities of daily living do not include the instrumental activities of daily living. For those unfamiliar or need a refresher, your activities of daily living are your basic self-care activities. So bathing and showering, dressing, eating, transferring, getting in and out of bed or a chair, and toileting. Your instrumental activities of daily living are other than basic self-care and needed for independent living, such as things like shopping, food prep, house cleaning, laundry, medication handling, that kind of thing. That is all I have for that slide. If I'll move on or answer questions later on that, on anything. Anybody has any questions with those? Assisted living expenses, generally deductible as a medical expense if the veteran or spouse is entitled to receive either housebound or aid and attendance benefits. We'll get to those in just a minute. A licensed physician has certified that the person has a medical condition that makes such a level of care necessary. Medical necessity is accomplished via the VA Form 2680. If a vet still lives in their primary home, but their spouse is in a facility, the same thinking applies in that a 2680 needs to be completed by the spouse's physician in order to create deductibility. 2680 is one of those forms that claimants don't touch. They hand it to their doctor and say, here, VA needs this. Independent living. This is of extreme importance to facilities who have both assisted and independent living options at their properties. The VA Form 0779 has a checkbox option for skilled or intermediate nursing care. If the claimant is in the independent living section of the property, the contents of this slide apply to them. I've handled scenarios with this kind of expense deduction, and it's much easier for us to get the claimant paid when that top section is included with the medical expense reports. So if they are in independent living, there needs to be that physician statement that they have to reside in that facility, and they have to have some kind of separate contracting with a third party for custodial care. What else? If you are a facility that has multiple levels of care that are differently branded, please make that clear to us. The VA uses Medicare.gov to verify some things, but we don't have a reference of any kind that tells us that your independent living is called X, but your assisted living is called Y. We have a very highly inefficient practice right now of cross-checking Medicare and Google to try and find something that matches. Some kind of convincing evidence would greatly help us as far as getting claims back out the door and getting folks paid. There we are. Third and final on income is net worth. I had a really nice blurb on net worth prepared, and then the rules changed, and they take effect today. So net worth is considered when determining entitlement to VA pension. Net worth is the market value less mortgages of real and personal property owned by the claimant and or spouse, except the single family dwelling and reasonable personal effects. The former training coordinator for the call center called a vet one day to try and get some clarification on something, and the vet said, well, what about my antique rifle collection? And he got caught short. He's like, no, just no. The pension program is intended to afford beneficiaries a minimum level of security. It is not intended to protect assets or build up a beneficiary's estate for the benefit of their heirs. Key in these new net worth rules, VA has instituted a 3-year look-back period for asset transfers, things like trusts or gifts. And we've also instituted a penalty period of non-entitlement that will not exceed 5 years, after which a claimant that got denied for excess net worth can reapply. Again, just to say it, entitlement is different from eligibility. A veteran or spouse can be eligible but not entitled in a case of excessive net worth. The vet might qualify on wartime service, or the spouse might qualify on marriage, but they won the lottery a few years ago and they have $12 million sitting in a bank account. VA also changed their net worth rule to match Medicaid. So that is a new and exciting development for us at VA. Makes a hard, bright line decision a lot easier. The old way had a lot of subjectivity, and we got rid of it. Aid and attendance is for vets and survivors who are eligible for pension and require the aid and attendance of another person. Those two forms at the bottom, the 2680 for medical necessity, the 0779 for a facility resident. An aid and attendance rating is not required if the veteran or spouse is a patient in a nursing home unit of a state vet's home, if they are in a nursing home that is under the purview of the Department of Veterans Affairs, or a state licensed extended care facility that provides skilled or intermediate nursing care. Popular forms. If you have a client who is thinking about submitting an application for benefits, please have them fill out and send in an intent to file, that third one down, a form 21-0966. Call center employees are authorized to fill this form out on someone's behalf over the phone. So that's an excellent thing. You can get them on the phone instead of having somebody fill something out and sign it. Intent to file forms protect a date of claim, and they create retroactive payments from when the intent to file was submitted rather than the actual application. So rather than just applying in July of whatever year, if the intent to file was received the prior December, the claimant would get paid from that earlier date, which is the first of the following month. So they would get paid effective January 1st instead of July or August 1st. If your client has trouble or is incapable of signing their name, please submit the alternate signer form so the claims processor doesn't have to send you a letter saying that the wrong person signed the forms. The wrong person becomes the right person if we're told that they're the right person. If your client has a child or a caregiver that does their personal business for them, include that third-party disclosure form, third from the bottom, the 0845. The call centers are only legally allowed to speak with the vet or spouse. So having a third party on file, a third party form on file, immediately lets that third party bypass the need to get the claimant's verbal permission. That's a legal release. You know, you have a vet that has some cognitive disorder, they have dementia, Alzheimer's, what have you. Their son does all their business for them. The son fills out the 0845, fills in the security questions, sends it in with their claim packet. They're good to go. The son can now talk to the call centers without any kind of other authentication. Excuse me. Claimants and families like to send in copies of existing durable or medical powers of attorney. VA does not recognize outside power of attorney documents. Our third-party recognition comes three ways. It's either the 0845, the disclosure form, on the bottom 2122, or in the middle that individual representation 2122A, or the alternate signer form at the top. Outdated forms are a very hot topic right now at VA because a lot of the forms are getting rewritten and recertified. A lot of our forms have recently been revised. So if just by chance you have any VA forms in your offices, the safest thing to do is probably destroy them and bookmark these links. You can never go wrong using the most recent form. The link to the general form library is down there bottom center. And the only place that I would at this point trust a VA form is from the form library. There's probably lots of outdated links floating around on the web. VA's form library is the source. Some tips and tricks. Always, when possible, always send a DD Form 214 in with the application. Also, in cases of spousal benefits, please send the veteran's death certificate. When it comes to bank accounts and interest when filling out the pension application, please always state the interest earned. There's a box on there for interest. We do not need bank statements. I'll also take that one step further. We don't need medical receipts. I used to tell people when I was in the call center that the VA is not the IRS. We don't ask for receipts. Okay. We don't generally want proof of purchase. We ask that claimants keep their receipts for 3 years because we reserve the right to ask for them, but please don't submit them. What we'll consider is what's written on the medical expense report form, and we generally can't consider expenses not written on the form. For spousal benefits too, complete marital history. Please make sure that the number of marriages match. And I've run into cases where there's a separate sheet because the spouse ran out of room. My record so far is dealing with a surviving spouse who was married 8 times. Her name was not Liz Taylor. Okay, here's your Letterman top 10 list. Top 10 delay-inducing pitfalls. Wrong signature or no signature. We covered that with the alternate signature form. If you are working with a veteran service organization like the American Legion, Disabled American Vets, what have you, they're great people. They can't sign forms. The power of attorney in the durable power of attorney. So if a claimant gives their son power of attorney and the son signs in the signature block and writes, "I'm the POA," no, we can't accept the form, unfortunately. Incomplete applications, sections left blank or missing pages. This is a big pitfall. This is the downside of faxing in your applications. Faxing can be generally faster, but fax machines also can eat pages, or people can just leave things blank. If a vet is applying for pension and they don't fill out the income details page, we can't adjudicate the claim for pension because it is a needs-based benefit and we need the income information. Not enough information to identify the vet. Like we've said before, the gold standard is a DD 214 or one of those certificates of honorable release that come from people whose records were destroyed in the National Personnel Records Center fire of 1973. Wrong information. Think things like bad address, flipped social security numbers, just things that don't allow us to say, oh, it's definitely this person. Wrong forms or outdated forms. We just covered that. Forms do get changed, and applications on old versions of forms generally cannot be accepted. There is a 1-year grace period if you are working with a veteran service office, but that's probably too much inside baseball at this point. Odds are just download yourself the new form and you will encounter success at that level. Number 6, claimant doesn't check off which benefit. The form for spousal benefits, the 534EZ, has 3 checkboxes on the first page. I also teach on the outside, and when I tell my students when something important is coming up, this is the one thing you want to take away. Well, this is the one thing you want to take away. If you get nothing else from this session, please let it be the first page of the spousal application. Box 16 is king. If the claimant doesn't tell us what they're looking for, we can't make a decision. Income or incomplete information, things like income boxes left blank, net worth boxes left blank, marital history. There is even tiny print on the forms that says we cannot accept a blank, please put a 0. If you are applying for aid and attendance, please submit medical evidence. The Form 2680 written up and signed by the doctor. That is one of the few VA forms, like I said, that the claimant does not have to touch. They hand it to their attending doctor. The doctor writes it up and signs it. They give it back. Done. Failure to submit nursing home information, whether that's the Form 0779 for the nursing home information itself, or if it's a claimant that's still living in their home and has in-home caregivers, we have caregiver statements for that kind of thing. We can't consider the expense of the caregiver without the caregiver statement. Sometimes vets and spouses pay their caregivers to the point that what they pay those caregivers is the difference in the income equation between grant and denial. We covered it also earlier, variable billing based on levels of care. Again, the whole independent living versus assisted living section. And let's see. Oh, just for that, one other thing. We work under the idea of counting higher income and lower medical expenses when in doubt, because we try to work to the benefit of the claimant. So again, with that whole change in billing, we try to be as claimant centric as we can while staying within the law. Also, two unpublished items, and this is from the claims processor side. I just have two other what we, I guess, can call pain points that I'd like to build a bridge regarding. Number one, please call us back. At least for the Philly Pension Center, the number on the caller ID is 215-842-2000. I have called business offices and I've been accused of being an identity thief. Also, too, it does not apply. Please do not cite HIPAA. When a veteran service representative is calling a claimant or calling a facility and trying to get info on the claimant, we are not looking for medical information. We're looking for location and financial information. When did they come in? When did they leave? What are they paying? When was their Medicaid take effect? And last but not least, ladies and gentlemen, thank you for what you do. Thank you for your time and attention. And the floor is open for questions, and I'll kick it back to Wendy.
Thank you, Mike. That was really great information that you shared with us today. At this time, we'll open up the question and answer portion. Please submit your questions using the question box on the right hand of your screen on the GoToWebinar pane. We do have one question already, and I'll read that. Can a military retiree or surviving spouse of one also receive VA pension? It used to be that military pension was reduced by VA pension.
Military retirees can receive pension. It just counts toward their the military retirement counts toward their income calculation. So if it's a, say, retired mid-high ranking officer and they make a couple of $1,000s a month in retirement, their expenses just have to outstrip their income. Receipt of military retirement is not a guaranteed bar. I think I put it in the way I put it in the slide notes was that we generally don't look at the source of income. We care about our ability to do the math.
Okay. Any other questions? I'm not seeing any right now, but we'll give it a minute or two and see if any other questions come in. Remember that PHCA has our annual convention coming up in a couple weeks. We'll be down at the Valley Forge Casino Resort, November 13th to the 15th. And if you haven't already registered, there's still plenty of time to register. There are rooms available at the venue, and we look forward to seeing you there. It is coming up, and we will be there, and the information's on our website. If you have any questions about it, you can give us a call. Okay, a couple more questions have come in. The first one is how/who notifies VA of the Medicaid approval? I work in a facility and people receive the full benefit a year or more after being approved for MA.
The easiest thing to do there is call the call center. Call the pension call center. Let us know who it is and when they started to receive the benefit. By law, we have to send out what's called a due process letter because you are asking for a reduction of benefits, and we have to provide due process of law. The way around that is if the claimant is cognitively okay, or if the family member has signature authority, send in some paperwork from Medicaid and top it with a I don't have the link in the form slide, a statement in support of claim, a VA form 21-4138, saying that you waive the due process period, and it could potentially go a little bit faster. The full rate continues just because the claim did not get worked in that time. So I mean, a year sounds full rate for a year, Dave, after being advised of Medicaid. That sounds a little high. But I mean, I've heard of a couple of months, but a year sounds a little high. But that would be the way to do it. Just let us know if it has the claimant's or custodian's signature. We can act on it directly. If it doesn't have their signature, we have to send a due process letter.
Okay. There's been a question about the slides being made available. Yes, I will be sending a PDF link to the slides so that you have them. You can reference them, download them, print them, tuck them away for future reference. But I will be sending that to everyone later today. The other question is, and I did not catch this number either, please provide VA phone number again. This person didn't write it down, and neither did I. So
the pension call center. Okay, 877-294-6380.
All right, and I will include that in my follow-up email as well.
Excellent.
Good number to put in your contacts. Okay, any other questions? We still have a couple more minutes here left in our hour. If anybody has any questions, if not, you'll get a couple minutes back in your day, but we still have time for more questions if anybody has any questions. And I will be also providing Mike's contact information. So if you think of something later or something comes up, in the next couple weeks, months, you'll know how to get in touch with him.
And if I can just throw one note out there regarding that, Wendy, if you have case-specific questions, please use the call center. I'm happy to help anybody as much as I can, but that's the reason the call center is there, is to help folks out. So us on the claims processing side, we can keep getting work done for you.
Great. Okay, another question. Do VA reps contact facilities for just checking to see VA members' needs are being met?
Yes and no. The yes part of that might be if the veteran has a custodian or a fiduciary. I don't work that area, so I'm not really going to comment on what they do or don't do. But the no part of that would be if they don't have a custodian. It's VA acts when we receive something from the claimant or regarding the claimant. So there's a yes and no side to that.
Great. Again, we still have a couple more minutes for questions. If you have any questions, keep them coming. We'd love to get your questions answered today. Don't forget to check out the PHCA website. We've got more webinars. We try to have, at least 2 webinars a month, sometimes more, sometimes less, but on average, we have about 2 webinars a month. We have one coming up later this month on October 30th, and it will be with our very own PHCA Government Relations Director, Zach Schamberg, who will be giving you some good information about the upcoming election that's coming up in November. So he'll have a review of the candidates and what you need to know to go to the voting booth in November. And then we'll have a mandatory abuse reporting webinar December 6th, and that will be coming out soon for registration. All right, I'm not seeing any more questions. I think we'll wrap it up for today. Again, I want to thank Mike for his time and for the information that he shared with us today. Please take time to complete the survey when you receive it. It's helpful for us here at PHCA and for our speaker. And again, thanks to Mike. We want to just wish everybody a good rest of your day.
Thanks very much again, Wendy, and thank you all for coming and hanging out with me for an hour.